Amy.
Hi, how are you?
Good. Thank you for taking the time to give us a testimonial
No
here at MFC Center for Health. First question I'd like to ask is, how did you find us? What brought you to the office to begin with?
I was feeling very, very ill one night. I was up in bed and I just started searching for, I guess, random things that I was feeling. I typed in, what did I type in that night? Excessive tiredness, not feeling well, and somehow Dr. Farley came up and I started watching his videos and I'm like, I need to see this guy. I don't know how, but I need to find him, I need to get in. And the following morning I called and luckily I'm here now.
Okay. So what were some of the symptoms you were having? Did you have a diagnosis of some kind?
I didn't, at the time I didn't have a diagnosis. I was very fatigued. I had rashes all over my body. I had stomach issues, a plethora of issues. I just wasn't feeling right and I didn't know why. And I came to see Dr. Farley, and around the same exact time I was seeing my regular general practitioner, and they took tests and they recommended that I see an infectious disease doctor. And around the same time that I was seeing Dr. Farley, I was diagnosed with Lyme disease.
Okay. What are some of the successes, if you will, that you experienced while coming to the office here?
Probably about a few weeks after Dr. Farley told me what I should and should not be eating, knock on wood, I haven't had any stomach issues since. My rashes have subsided probably about 90%. I still have low fatigue due to the Lyme disease, but I have more energy. My husband always says, you know, look at you, you're up past 9. There was a point in time when I would get home from work and 5 o'clock I was in bed for the rest of the night. Now, last night I was up until 12:30 doing stuff. I'm up, I'm around, I'm doing stuff. Food is still a challenge for me, but hopefully I'll get there soon.
Okay. Had you been to a number of different doctors, practitioners in your pursuit for getting better?
Dr. Farley was the 32nd doctor that I saw.
Is that right?
Yeah. And
Okay.
every doctor I went to, let's take this test, let's take that test, but there was no definitive answer of what was wrong. And before I told Dr. Farley that I was diagnosed with Lyme, he actually said to me, do you think that maybe it could be Lyme? And I had been tested for Lyme disease in 2014, but because I didn't hit the 5 markers, they never told me I had Lyme disease.
I see.
So.
Okay, so lucky number 32nd.
Yes.
Okay, how do you see yourself now in terms of your future and your health now that you've gotten on this track, as opposed to where you think you may have wound?
Something that Dr. Farley always said, it's a lifestyle. So it is a lifestyle change, and I've made the change. Every time I come in and I meet with him, he always looks at me and he asks, are you sticking to the diet? And then he looks at me and he's like, no, I know you're sticking to the diet. Everyone around me now is starting to change. My family's eating differently because I have to. I recently just received stem cell, so I'm still following that journey. It's difficult. There's days when I'm still very tired. There's days when I'm seeing, blurry. Right now I'm seeing spots, but you get through it. I hope that after the 9 weeks, which is up at the end of this week, I do start feeling better post stem cell. With the guidance of all of you and Dr. Farley, I'm hopeful.
Good. Very excellent. Okay. Any suggestions for improvement? What are your thoughts about the staff and how you've been treated when you come here?
It feels like they're my extended family. I'll receive text messages on a Saturday when I know you guys are not here. I hope you're feeling better, Amy, if they knew that I came in on a Thursday and I wasn't feeling well. So you are all amazing. I'm very, very happy that I found you, and I would encourage anyone. I know, money's an issue, but there's a way that Dr. Farley will work with anyone who comes through his doors, and I'm a believer in everything happening for a reason. So for whatever reason, my illness, I guess, or the way that I'm feeling right now, I use it as a positive, not as a negative, so.
Well, good. Well, we're happy to see that you're making the progress that you have made and continue to make, and so thank you for taking the time and sharing your experience with us.
Thank you.
Thanks, Ed. Okay.